Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Good evening! Magandang gabi po sa inyong lahat at maraming salamat sa inyong patuloy na pakikinig sa aming programa. Every Monday here at PHLV Radio. Another Monday night we are offering to our listeners in the Valley and beyond. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Apina of Nevada and professor at Roseman University College of Nursing. Welcome to Healthy Monday. So, mga kababayan out there, mental health nurses work in a variety of settings and support and treat people who have been diagnosed with a mental illness. Just like in physical health, nurses can promote mental health by building good relationships with patients, encouraging healthy behaviors, and recognizing and treating symptoms early. Statistic-wise, 1 in 6 Americans suffer from a diagnosable, treatable mental health conditions. However, minority groups, African Americans, Hispanics, Asian Americans, and Native Americans are more likely to experience the risk factors that can cause such mental health disorders. So tonight, I have my colleagues and friends all the way from the East Coast to share important information and opportunities to those who are interested in learning about Substance Abuse and Mental Health Service Administration's Minority Fellowship Program at American Nurse Association. In short, SAMHSA MFP at NNA. So Janet Jackson, Sister Janet, is a project director of the SAMHSA Minority Fellowship Program at the American Nurse Association. As a seasoned professional with a successful track record of over 4 decades of nonprofit leadership, Janet understands what it takes to lead the MFP with vision, purpose, commitment, and compassion. She has presented the MFP training model at international nursing conferences in Yokohama, Japan, Melbourne, Australia, Prague, Czech Republic, Beijing, China, Durban, Ireland, South Africa, and the Republic of Malta. Janet is known for driving the expansion of the MFP pragmatic offerings and resources, maximizing operational excellence and providing skillful leadership that engages the MFP team, National Advisory Committee members, the MFP alumni, and other key constituencies in developing the MFP's strategic future. So born in Washington, D.C., Janet spent her early years growing up around Knoxville, Tennessee, and earned a Bachelor of Science degree in Broadcasting, News, and Public Affairs from the University of Tennessee, Knoxville. She should be hosting the show, I guess. She went on to become a fellow in the American Society of Association Executives Diversity of Excellence Leadership Program, and she trained as a mental health first aider through Mental Health America and holds professional memberships in the American Society of Association Executives, the National Association of Women Professionals, and is an honorary member of the National Alaska Native American Indian Nurses Association, or NAANINA. So let me read about Samuel also. Samuel Suraphel is an entrepreneur, global program manager, and technology specialist with over 19 years experience designing, managing, and successfully completing complex projects that require creative problem-solving skills and leadership in a multicultural environment. He has led education technology projects in East Africa, youth entrepreneurship training across multiple countries on the African continent, and has supported the launch of nonprofit and for-profit ventures. Since 2015, he has supported the program management of the Master's Fellowship and Technology needs of the SAMHSA MFP and ANA. He leads the digitization, automation of the program's key activities, and produces live and pre-recorded webinars that serve as part of the MFP's training offerings. So welcome, Janet and Samuel, to Healthy Mondays.
Thank you.
Thank you. Thank you for having us. It's exciting to be here.
Yeah, so I haven't seen you guys for a long time. So it's really exciting to see you virtually.
Exactly.
Yes, so since we are all friends, if it's okay for both of you to call each other by our first name.
Yes, that's fine.
Yes.
Okay, so let's start, Sister Janet. Okay, if you wanted to share a little bit more about yourself and how you became a part of the SAMHSA MFP.
Some years ago, when in another position, when I worked with trial lawyers, I had the opportunity to experience firsthand someone that suffered from mental health challenges, and this individual confided in me, and I became an advocate for them. To the leadership at this particular organization, and the person went on to seek therapy and recover from the episode that they were experiencing. Um, and so when I left that organization and I saw this position, the MFP, in the Washington Post at the time, the ads were still in print, and so when I saw that position, I realized, even though I didn't have all the qualifications, for the position, I wanted to be an advocate for mental health among minority populations that suffered from mental health. I wanted them to know that it's okay to seek therapy. Mental health is health, and just a part of our whole health. Health. So that's how I came to ANA. And so I've been there 18 years.
Wow. Just so I wanted to share with our listeners out there, thank you for sharing the history, how you became part of a big Ohana family of the SAMHSA MFP. I just want to give a brief, before introduce Samuel, that mental health disparities have received increased attention in the literature in recent years. After considering 165 different health disparity conditions, the Federal Collaborative for Health Disparities for Research chose mental health disparity as one of the 4 topics warranting its immediate national research attention. And CDC defines and described mental health disparities as often falling into one of the 3 categories. Number 1, disparities between the attention given mental health and that given other public health issues of comparable magnitude. And second is the disparities between the health persons with mental illness as compared to those with that who doesn't have mental illness. So now I wanted to ask Samuel to share his story about how he became a part of the Ohana of the FMP. Go ahead, Samuel.
Thank you, Mary Faye. So in my case, I'm a part of the African immigrant community, and in my sub community within the Ethiopian immigrants, I had noticed some years back an increasing number of suicide attempts, and from that, and having been involved in many immigrant community issues, it saddened me to see that someone's life would end after the great length and journey that they've made to sort of establish themselves in the U.S. And so I started going to different events that dealt with mental health, substance use around the immigrant community. And so fast forward, when I was working as an entrepreneur and an opportunity came up to join as a contract program manager for the new youth program, the MFPY Youth, it combined many of the issues that I had been, interested and passionate about for some years at that time. So looking at young youth and also this issue of mental health, and then applying my background around program management and technology was just it was a no-brainer that I had to join the Ohana.
It seems like the 3 of us got involved with MFP because of our big P, passion.
Yes.
And I know that it starts with a passion. I know my nursing students, I keep reminding them, keep that passion, but at the same time, have a purpose. And then with that passion, purpose, persevere, because there are a lot of roadblocks, especially a lot of funding roadblocks. So I'm very blessed and truly blessed to have been part of the SAMHSA MFP Nurse Scholars, who received the benefits and now trying to reach out to our community to increase awareness about mental health. And I think this would be a perfect time for Ms. Janet, Sister Janet, to share with us, a clear understanding. What is SAMHSA MFP? What is it all about? Why does it exist?
Well, I'm going to take you all the way back to the early 1970s, Mayor Faye. And so back in the 1970s, many professionals believed that the scarcity of behavioral health professionals from culturally and linguistically diverse backgrounds constituted a workforce issue that was causing health disparities, the quality of care, and access to mental health and substance use treatment among ethnic and racial minority populations. They believe that this scarcity of behavioral health minority providers was causing the health disparities. And so Dr. Mary Stark Harper, who was a nurse trailblazer, she was in leading positions at the National Institute of Mental Health, decided to write a grant. And so the mission of that grant was to increase the behavioral health workforce with a diverse behavioral health workforce to meet the needs of the increasing behavioral health population, or the ethnic minority population. So she wrote the grant, and it was awarded in around 1973, and then she walked the halls of Congress to get funding for that grant. And the first grant was awarded to the American Sociological Association. And so about a year after that, NIMH invited the core behavioral health organizations, which was the American Nurses Association, the American Psychological Association, the American Psychiatric Association, and the Council on Social Work Education, to write the grant. And so those four core behavioral health organizations were awarded the grant in 1974. And those four organizations they were the only ones that had that grant up until 2014, when Marriage and Family Therapy came on board. And then the National Board of Certified Nurses, National Association for Addiction Counselors. And so today, SAMHSA funds 6 MFP programs. And because of this program, thousands of behavioral health professionals have been able to receive advanced degrees and to help diversify the nursing workforce, to provide the care, research, education, and health policy advocacy for individuals that suffer from mental health and substance use.
Wow. Thank you for taking us back to 1970s. You know, as I was listening to the story, it truly evolved into an interprofessional collaboration. And I'm just, again, blessed to be part of the recipients of the program. I remember my mentor, Dr. Jillian Inoue from Hawaii, who happens to be also an alumni, had pondered upon me just recently. She said, Mary Faye, the mantra now in healthcare is interprofessional collaboration. So it has been and should be a mantra to have an interprofessional collaboration, because nursing is not an island. We always have to reach out to our counterparts in the healthcare team to be part of our endeavor and our passion to serve our community. So,
and you're absolutely right. And SAMHSA recognizes that. And just recently, as a matter of fact, as of September the 1st, we have launched a new grant, which is the Interdisciplinary Minority Fellowship Program. Now, they only awarded one grant, and so the American Psychological Association applied for that grant, and it was awarded. And the American Nurses Association, Council on Social Work Education, and the National Board of Certified Counselors and Addiction Counselors, we're all sub-awardees of that new interdisciplinary grant.
How exciting. That's excellent. And
yes.
I was just looking at my notes here, and I did say CDC defined the health disparities with three categories, and I only gave two categories. So the third categories for that, well, going back, the first category, there was disparities between the attention giving mental health that given other public health issues of comparable magnitude. The second one is disparities between the health of persons with mental illness as compared with those without. And the last one is disparities between populations with respect to mental health, quality, accessibility, outcomes of mental health care. So SAMHSA MFP is addressing the needs to increase special ethnic minority mental health providers because we need to be culturally sensitive to the needs of our clients and patients, because you can't get to the bottom of what's really happening to them if you are not culturally sensitive. So now, Samuel, you can share about the MSN, I guess the Masters of Science portion of the SAMHSA MFP.
Sure. So it originated as an output of the Sandy Hook Elementary tragedy that occurred some years back, and it was launched as part of a multi-tiered effort under the Now's the Time initiative to really try to get at reducing those things that contributed to that tragedy. And so in the area of mental health, it was again to sort of continue on with the mission of the MFB, broadly speaking, around creating an increased number of minority professionals that can go in clinical settings, primarily to address particular issues within those minority communities around mental health and substance use. But in this case, also looking at the sort of categories of children, adolescents, and youth in transition aged 16 to 24. So folks who are focused in going into those communities, specifically demographics, to make a change and figure out the nuances of closing the mental health and gaps for that. And so that's how the program started, and we were able to actually identify many individuals that are going into that psychiatric PMHNP sort of clinical setting practitioners, nurse practitioners, and graduate them. And then as we moved on to the newer grant, it was decided to sort of look broadly again across the lifespan, though we do have still a significant amount of our applicants who are passionate about going in and making a difference in the sort of children, adolescents, and youth in transition age range. Because as we find, especially in the time that we're in now, where the existing healthcare, and mental health disparities are compounded by the challenges that we're facing due to COVID and the changes and dislocation that's happened in terms of schools and communities and COVID, as well as other challenges that we find ourselves. We really have to be focused on making sure we have practitioners and also research from our other fellows that can help identify and find remedies to support those populations.
Yes, and I know that after the program that you're in charge in, then the scholars can proceed and continue into the traditional MFP fellowship.
Yes, and that's one of our goals, is to sort of create a pipeline to the doctoral fellowship, and we've had success in that with a few of our master's fellows going on to get their PhDs and DNPs or on the track for that.
So ultimately, our goal and the reason why I have, for our listeners out there, and the goal that I have Samuel and Janet join me tonight is to just increase the awareness that this resource and available to all the ethnic minority nurses who really are passionate. Now you can have a purpose and you can persevere, because we all know that part of being successful academically and reaching out and obtaining your degree is finances. And then, to be honest, without the program, I would have just be content with keeping my master's degree. But because this is available to me, and because there is a passion, now my purpose became bigger. It became bigger because now, and it became bigger, and I persevere. It's not easy to be in the advanced degree. There's a lot of sacrifices. It takes like 5, 6 years, and some 10 years, 7 years to finish the degree. But it's all worth it because now I can help the community better. I can represent the Asian community better as my passion, and all the other ethnic minority communities reaching out there. But what I wanted to ask Sister Janet is to give like a short preview of what are the qualifications for those who wanted to get into the traditional doctoral fellowship.
Well, first of all, they have to be a psychiatric nurse. They have to be RN, licensed. And they have to be enrolled in a doctoral program, already enrolled in or have applied to a doctoral program at in an accredited nursing program, and they have to be full-time. And so and they have to be a U.S. citizen or a permanent resident and of one of the ethnic racial minority populations that the grant serves. So those are the qualifications for the doctoral program. Upon graduation, they have to make a commitment that they will at least provide direct care to minority populations 2 years after they graduate from the program. So those are the qualifications. We have the PhD program and the DNP program. So those are the qualifications for that particular program.
Yes, I remember that the DNP program was just being implemented by the time I'm finishing my PhD. The increased number of DNP programs nationwide. I guess it allows the doctoral program to be comparable with, and the main goal is servicing our community in the mental health field. And I think, Samuel, for you, I wanted to ask you, I know we already have some master's degree students in the mental health field who are already our scholar. And if they wanted to jump the hoop, I guess, per se, going into the PhD and DNP into our traditional fellowship, what would be your advice? Maybe they are not yet in the fellowship program, or they are. So what would be your advice to them to be successful in the MSN fellowship that you are in charge of, and how they can then proceed into the to the traditional?
Okay. So what we usually tell aspiring applicants to the master's program, and then also those who are going to transition into the doctoral program, is for them to, one, there's more of like let's say the purpose side of it, using sort of your purpose, passion, and perseverance, is to go on our website and actually go through the roster of folks who are alumni from the master's program and even the doctoral and DNP, the traditional program, to kind of see the scope of the work that they've done and are doing throughout their academic careers and looking forward. The reason why is a lot of times we find fellows, when we go out on our recruitment, when we go on recruitment conferences, at ethnic minority conferences, a lot of folks are considering whether they want to get into psychiatric mental health nursing or not. And so what we want to do is expand their understanding of what that is. We are often told that they are interested in it, they're passionate, mostly they have a personal interest in it, but maybe due to sort of influences at work or what they're told, they might have constrained their thoughts of pursuing that further. And so by going on our website and reading the biographies of our current alums and our current fellows and our alums, they're able to sort of expand their understanding of it. And we actively encourage them to reach out to us so we can make a connection to them so they can even learn a bit more. Now, on the application side, when they're preparing their application, we tell them always to get started as early as possible. We've upgraded many years ago to our application system that allows someone to start and continuously save the application. So it's not that they have to do it in one sitting. And so by doing that, they can get started on filling out the parts that are easy for them. And if they have any questions, they can reach out to us as staff to assist them in answering any major issues. They can begin soliciting references, which are always a sticking point for people to getting in their applications on time. And so they can also use that time to craft, in the case of the master's program, it's a one-pager that describes how they plan on sort of aligning with SAMHSA's goals for the program. And in the doctoral program is they have to present both a piece of scholarly writing and an essay. And so making sure that they're doing that at the level that is competitive, and that takes time, that takes them reaching out to their level of resources and mentors, whether it's at work or at school, to make sure that it meets that, because we are increasingly finding it to be more and more competitive. And so we encourage folks to start early and use that time to their advantage.
Thank you. I think it resonates in my mind when I'm teaching my students. First time I meet them in class, I ask them about what specialty in nursing they would like to pursue. And when everybody says critical care, med-surg, and I said, who wants to be in the psych mental health? And no one raised their hands. And I guess what? I have news for you. You don't have a choice, regardless, because the individual you're taking care of who has schizophrenia or mental health illness could be in the med-surg floor, could have diabetes and now had complications of diabetes, and you have to take care of that patient. And maybe that patient would be in the ER, or maybe in the ICU, intensive care unit, or maybe in the clinic, because a person, an individual, has mind, body, and spirit. So I try to emphasize that, because I know you mentioned, they had the passion to care for individuals who have mental health illness, but then they're persuaded by work, like, oh, don't go in that one, because that's too complicated, that's too much. But they don't realize, that a person is made up of mind, body, and spirit. So that's my little story there. I always like to tell stories, and I can see, thank you for your advice, like putting together your application is like, okay, this is too much for me, and then they just give up. Do it one at a time. Look at what's the requirement. What I did is I pull out what's the requirement, put it on a Word document, and then start typing it one by one and have someone look at it. Identify an unofficial mentor or someone who can look at it, so then your writing and what you're submitting is at that level where you can compete with other people to get the fellowship. So guess what? Time flies when we're having fun. It's already been like 30 minutes. Isn't that really quick?
Yeah.
So
I would just like to add, Mayor Faye, before we move on, I'd
yes.
like to add to what Samuel said. We've actually posted about 5 tips on how to have a successful application, because as he mentioned, the number of applications that we are receiving, the volume has really grown since you were in the program, and we only have a limited number of slots. So, we'd like to encourage all of your readers to go to our website and look at those tips, and then look for when we have informational sessions. We hold a session where individuals that are interested in the program can participate in a webinar that we have, and we will explain the program, the application process, and answer any questions that they might have. So that's another, a great opportunity for them to participate in.
So can you share with us the website? And of course, while we're broadcasting, hopefully at the bottom of the screen, it would show the website that they can go to with additional information.
Right. The main website is www.emfp.org. apply.emfp.org. But the page where the application page is apply.emfp.org. So that's where all the application pieces are at that page. But once they log into the main page, they'll see a big red sign that says apply. So just click on that sign, that'll take you right to the page.
Excellent. Well, maybe last words of wisdom from both of you. Maybe Samuel, you can start. Any words of wisdom to our listeners out there?
Oh, well, so I think for words of wisdom, I would want to say thank you to the future scholars, policymakers, and clinicians. You know, every time I have the fortune of meeting someone who's interested, and then you see them join the program, and you see their commitment to reducing disparities, to finding something novel that hasn't been researched before to apply to the field. I'm always, delighted and excited by what's forthcoming. And so I'd say to anyone who's sort of on that consideration, kind of on the borderline, and thinking about it, please go forward. You have a welcoming community of staff and current fellows and alumni that are there to support and allow you to, do the great work that you do.
Thank you, Samuel. Sister Janet?
Well, I don't know if I can add to what Samuel has already said, but I think what I always tell applicants and the fellows that get in the program, anyone that is not considering applying or advancing in their degrees, is once you get appointed to the Minority Fellowship Program, we would do whatever it takes to make sure you succeed in the program that you're enrolled in at your university and graduate, because our goal, we are committed to helping to diversify the nursing workforce with more minority nurses to take care of populations that suffer from mental health and substance use. And so we are the MFP family. And so once you get accepted in the program, once a fellow, always a fellow. A lot of our fellows, while we know that financial support is a big need, but one of the things that the fellows tell us, it's the networking, the peer support, the academic support that they get far outweighs the financial support that they receive from the MFP program. So anyone that is considering the program, we encourage you to go to our website, www.emfp, and apply and hopefully join the MFP family and help us, join with us in diversifying the nursing workforce to help reduce the health disparities that we're seeing among ethnic and racial minority populations.
Thank you so much, both Samuel and Janet. I mean, excellent. There's so much more information that we could share to our listeners out there. Actually, it would be more powerful to hear from the current fellows who are going through the program and receiving the benefits that our family, our big Ohana, is providing to everyone. It's the relationships, really. You know, when I got interviewed a while back, I focused on the relationship. You know, of course, you know, the academic support and all that, but most importantly is what I got is that I gained new friends and eventually turned to family. And once a fellow is always a fellow. Once Ohana is always Ohana. So even though we don't see each other for many years, once we get together, it's like yesterday.
Yeah, it's like a big family reunion.
Yes. Could be in Hawaii, right? I feel like I am. But thank you so much, Samuel and Janet, for being our guests tonight. It's just being a recipient of the program, I can't tell you from the bottom of my heart, I am just so happy that I was able to be part and be given that opportunity. And also, of course, PHLV Radio for your partnership as our community partner to bring important information such as we have tonight to our listeners out there. So remember, everyone listening out there, remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.